It'll be another week or so before we actually know whether our current vaccines are effective against the new Omicron variant. But health experts are hopeful they will offer at least some protection. Here's where we stand on that front. Right now, nearly 60% of the country is fully vaccinated, meaning a little more than half of the people around you at any given time have likely gotten the shot or shots, though that can vary depending on your location. Again, this is among all ages. Among adults, so just those 18 and older, at least 7 in 10 are fully vaccinated now. Just 23%, though, have received a booster dose. I want to bring in CNN data reporter Harry Enton because we have new polling about boosters and Americans' intentions to get them. Harry, health experts say Omicron is every reason to get vaccinated and that booster dose. Are people listening?
I mean, look, not real. Some of them are. About half of Americans essentially are listening, or at least American adults. Look at this. What we could see is the percentage of Americans who say they're going to get the booster is 53%. That's up a little bit from October, where it was 50%. You'll notice that 71% of all adults are currently fully vaccinated. So many fewer adults at this point say they're going to be fully vaccinated get the booster than be fully vaccinated. And what I want to point out is a historical sort of landmark, which is if you look right now at the polling, 53% of all adults say they will get the booster. If you go back a year from ago, you would say that 71% of all Americans said they would get vaccinated. So right now we start at a much lower baseline as the administration tries to get people to actually take the booster.
I got my booster a couple weeks ago. I can say I feel stronger and happier and more optimistic than I've ever felt during this pandemic at this point. And that was, a real positive reaction, I guess, to that booster. There is a clear divide, though, right, among those who are and who aren't getting vaccinated. Break it down.
Yeah, and I'll point out, I've also got my booster, and I felt fine, and I felt great. I'm going on, everything's groovy. Look, if you look right now at the people who are actually getting that booster, you see this wide partisan divide. Look at this, 41-point partisan divide. 77% of Democrats say they'll get it. Just 36% of Republicans. That's even larger than the divide we see among those who are fully vaccinated, where you see basically just a 30-point divide. So an even wider partisan divide on boosters. And here's the whole problem, I think, is if we're going to try and convince those who haven't gotten vaccinated at this point to go forward and actually get a vaccination, Joe Biden might not be the person to actually do it, because what we see in the polling is that only 8% of Republicans approve of the job that Joe Biden's doing of handling the coronavirus pandemic, and just 13% of the unvaccinated. So it's just really this hard public messaging. How do you convince people to actually get a booster or to get vaccinated when these folks don't like the guy in charge?
Okay. It's the messenger. Thank you, Harry Enton. I appreciate it. With us now, Dr. Megan Ranney, professor of emergency medicine and associate dean of public health at Brown University. Dr. Ranney, you heard Harry break down that latest polling. What stands out or concerns you most?
So the thing that concerns me most is the folks that have not yet shown up for that first series of vaccines. Boosters are essential in giving us that added protection to Omicron, but let's be clear, that first series of vaccines is what matters most. The political divides concern me, the geographic divides concern me, and I'll say something that he didn't mention that also concerns me is the percentage of pregnant women and kids who have not yet gotten their vaccines. It's putting so much of our community and our little ones at risk.
Why do you think pregnant women are still so hesitant?
As someone who has 2 kids herself, I'll say that when I was pregnant, I thought 3 times over about everything that I put into my body. It is a normal process of wanting to be a good mom. I avoided soft cheeses and deli turkey. And so people have normal questions about this vaccine, which they perceive as new. I think the thing that folks aren't realizing is the danger that they're exposing themselves and their unborn children to if they do catch COVID while they are pregnant. The rate of stillbirths skyrocketed last year among women who caught COVID. The death rate for women who catch COVID while they are pregnant is dramatically higher than the death rate for women who aren't pregnant. The important message that has not been transmitted is that the best thing you can do to protect yourself and your baby is to get that vaccine.
That's such an important message. We are learning more now about this second confirmed case of Omicron detected here in the U.S. This was to be expected. And like the first case detected in San Francisco, this person was also vaccinated and experienced mild symptoms. However, unlike that first case, this person didn't travel outside of the U.S. and apparently experienced symptoms and tested positive even before South Africa announced it had found this variant. What's the big takeaway here, do you think?
The big takeaway is Omicron is already here and spreading in our community. You know, this person showed up and got tested because they're responsible. They noticed they had symptoms and they wanted to do the right thing. God knows how many folks across the country have Omicron and may not have even realized it. You know, those travel bans were too little, too late. And the last piece of takeaway from this second case is still that the vaccines are protecting people from severe disease and hospitalization. Both of the two cases identified so far have been in folks that were vaccinated, but so far as we know, not boosted, and neither of them were very sick. A very different story from what we're hearing out of South Africa.
And in that line of thought, you know, it's been about a week since we first learned of Omicron. There is still so much we don't know, but is the picture starting to fill in about the threat it poses?
Little by little by little. Really, Anna, it is a day-by-day process of learning more about how transmissible this new variant is, how much it is able to escape the vaccines, if at all, and how sick it is making people. And I will say the early signs out of Southern Africa are not good. These reports of community spread are also concerning, but it still seems that the vaccines are doing their big job, which is keeping us from getting really sick, hospitalized, or God forbid, dying.
Here's what we expect to hear from the president any minute now when he addresses the nation as he lays out his plan to combat COVID this winter. New testing requirements for international travelers, an extension of the mask mandate for domestic travel, a national campaign for booster shots, hundreds of new family vaccination sites, at-home testing covered by insurance going forward, and tens of millions of free at-home tests. Do you think this plan will be effective?
I think it's a step in the right direction. Honestly, anything that we do is better than nothing. And we have Delta variant here already. We're already seeing surges across the country, even without Omicron. So I'm glad to see the Biden administration stepping up with these plans. But honestly, I would like to see more. I would like to see those tests available for free or low cost without having to submit it to insurance. I would like to see increased funding and access to tests for state and county health departments. I want to see vaccine mandates for all flights, certainly international, but also domestic, including American citizens. And I also would like to see increased support for our healthcare workers who have been on the front line for the past 20 months, are burnt out and exhausted, are already facing surges across the country, and are not sure how they are going to make it through another winter of this disease.
My goodness, it's hard to believe it's been almost 2 years. You are doing incredible work, Dr. Megan Ranney. You and your colleagues and other healthcare workers, thank you so much for all you do and for continuing to be a guiding light for the rest of us. We appreciate you very much.
Thank you, Anna.